Okay, we are going to discuss diabetic neuropathy. It occurs in 50% of individuals with diabetes, either diabetes 1 or 2. I mean, it is not specified. The patient with diabetes, 50% of them will develop diabetic neuropathy. And this neuropathy can pathologically manifest as DSPN, distal symmetric polyneuropathy, or autonomic neuropathy, or third form is mononeuropathy. First of all, DSPN, distal symmetric polyneuropathy, is most common form of diabetic neuropathy. Most commonly, we see DSPN. There is distal sensory loss, distal symmetric sensory loss, which manifests as pain, numbness, tingling, sharpness, and burning. It begins distally and spread proximally. Lower limbs are affected more than upper limbs, and pain worsens at night. Right? The pain increases at the time of night. Second type of neuropathy that occurs is autonomic neuropathy. Means autonomic nervous system is involved. Either cholinergic symptoms will be seen or adrenergic symptoms will be seen. Right. We will see resting tachycardia, orthostatic hypotension, gastroparesis, hyperhidrosis or anhidrosis. It is usually said that hyperhidrosis occurs in upper limbs and anhidrosis occurs in lower limbs, which will lead to dry skin of feet, which will prone the patient to the development of ulcers. Right. What else can occur in autonomic neuropathy? There can be delayed bladder emptying or difficulty in emptying the bladder. Right. That is all about neuropathy, autonomic neuropathy. Then comes the mononeuropathy. What is mononeuropathy? Mononeuropathy means involvement of single nerve fiber. It is less common than DSPM. Right. There is pain and motor dysfunction in the distribution of a single nerve. Most common nerve involvement is third cranial nerve. We will see diplopia, ptosis, and ophthalmoplegia, but surprisingly, uh, pupillary constriction as a response to light is intact. Right. Mononeuropathy multiplex may also occur. It means that two nerves, either cranial or peripheral, or both, two nerves which are not contiguous, they get involved. For example, ulnar nerve gets involved and common peroneal nerve gets involved. Means these are two nerves, they are anatomically not contiguous and they are getting involved, producing their own signs and symptoms. So that is mononeuropathy multiplex. In mononeuropathy, we also read radiculopathy. Means a nerve root is involved. Or there can occur plexopathy. Means plexus is involved. Plexopathy. Right. Nerve, here plexus is involved. For example, lumbar plexus gets involved. If lumbar plexus gets involved, then what will happen? Uh, the nerves, the muscles which are supplied by the lumbar plexus, for example, the muscles of the, for example, hamstring muscles or muscles of the glutes, they will get involved. There will be pain, sciatica-like features, and there will be wasting of these muscles. There will be amyotrophy, also known as diabetic amyotrophy. Right. Radiculopathy means one root is involved, for example, sciatica. Right. So that is all about mononeuropathy. So three types of diabetic neuropathy: DSPN, autonomic neuropathy, and mononeuropathy. Now, what is the treatment? Treatment of diabetic neuropathy is basically lifestyle modification, good glycemic control, avoid neurotoxin. Although the most effective treatment is prevention. None of these treatments is 100% efficacious as far as treatment of diabetic neuropathy is concerned. So you will not be able to reverse the diabetic neuropathy to its 100% pre diseased state. So it is very important to prevent. Though what can be done as a part of treatment is lifestyle modification, good glycemic control, avoiding neurotoxins like alcohol and smoking. Then there is vitamin supplementation, which is very much effective. Metformin can reduce the absorption of vitamin B12. So it is very important to give vitamins. For example, B complex, especially B12, which helps in the formation of myelin. As far as drugs are considered for the treatment of neuropathic pain in diabetes, There are two FDA approved drugs. One is pregabalin, second is the duloxetine. Other drugs which are effective in neuropathic pain is TCA, carbamazepine, tramadol, and venlafaxine also. Right. How to treat orthostatic hypotension? As it is treated in other causes of orthostatic hypotension, that is increased salt intake, physical exercise, right? Then non-pharmacological maneuvers, right? How to treat resting tachycardia with the help of beta blockers. So these are symptomatic kind of treatments. Otherwise, for pain, we have these FDA approved and non-FDA approved drugs. Uh, other modifications or other methods, other interventions other than pharmacologic interventions are lifestyle modification, glycemic control, and avoiding the neurotoxins. So that is all about diabetic neuropathy, its causes, its types, and its treatment. That is all.